Hi, so today we're going to be joined by Dr. Scott. He's essentially a general practitioner in America, who's also the Chief Operating Officer of Troscriptions. And today we're going to be talking about a fantastic product called True Blue, or Methylene Blue.
Indeed, yeah. Thanks, guys. Thanks for having me. It's nice to be here in the morning, speaking to you in the evening. So,
well, this is actually, I think it's probably one of our favorite products at the moment because we use it quite regularly as our way to get through difficult days when we've got no energy. And I would say we really see the change in focus and the change in actually even energy and motivation, I would say, that it brings when you take it. So we kind of wanted to show all our listeners a little bit more about it.
Yeah, and we kind of, I know I got into it simply by seeing a lot of kind of people who are into biohacking suddenly talking with a very, very blue tongue. And try to work out why do they have a blue tongue?
Yes, it is a very blue product. This is true.
It is very blue.
Blue
maybe
in
what it is.
Blue out, as we say. So
oh yes, yeah, we noticed that side effect too, that you have the blue tongue and the blue urine at the same time as well.
Indeed, yeah. So it's a fantastic product. Methylene Blue's been around a long time. I'm glad you guys have both had an experience yourself. Have you also been using it in the clinic with your patients and clients?
Yeah, Jessica has, yes.
Definitely. Yeah, and I've been using it a lot with my patients, a lot more over the last probably maybe 6 months or so. I've started using it a lot more, and I've been using it for a range of things. And I think nearly all my patients have found big benefit using it. Actually, I've used it in some conditions, as I know it's got a little bit of research, things like motor neuron disease, and I've got some not very well patients with that we've been trialing it on in low dose to see how they go. And then for a lot of people, I've done it for brain fog to try and help them a little bit get through work and be more productive. And for my biohacking end, who really like to optimize their performance, they've seen a real change using it too. It's become very popular in my clinic.
Yeah, we had a few with like long COVID as well, didn't we?
Oh yeah, long COVID's the other thing because of the trial that they did on that. I've actually, I think it works very well for that. I think it makes a real difference.
I mean, that's exactly how I would describe it when I talk to most of the clinicians that work with the product, and I work with it myself in my own practice as well. And it runs the gamut. It can really run the gamut from helping people that are just wanting to be more optimized to helping people that are really sick and everybody in between. And I think it's because the mechanisms are very, very universal. The idea of just increasing the amount of energy you make in your cells and also increasing the resilience of your cells after you make that energy. Because I think most people don't realize that it's kind of like putting gas in a car. There's exhaust, right? There's the same thing happens when you make energy in your cells, and this place in your cell called your mitochondria. You make energy, and then at the same time, you make what are called waste products, basically. But they're not really waste products. They're things that the body needs. Carbon dioxide we breathe off. Everybody knows that. Water we make when we make energy, or ATP. And we also make what are called reactive oxygen species, or oxidative stress, or free radicals. There's all these other words for it. But what happens is the body needs those in small amounts to help signal when they need to make more, when the cells need to make more energy, when they need to change how many mitochondria they have, a lot of different kinds of things. But if the body is already under stress and you give the body ability to make more energy, what's going to happen is you can make more of these waste products and the system's not going to be very happy. And so the beautiful thing about Methylene Blue is that it does the energy production part, and it also does the antioxidant part, because the antioxidants are the ones that balance out the oxidative stress, or the reactive oxygen species, the free radicals that are made from energy metabolism. So that's why I think it's really could be used almost across that gamut, really, which is the super sick people and the people that are really super healthy that want to optimize.
Yes. So essentially, what I'd like to know is how it started. I mean, I know from doing a little bit of research in the past. I mean, I will generally just try things Jess tells me to try. I'm quite good at the human guinea pig, but
nice.
I see massive benefits. But I also, fundamentally, it is a drug, isn't it?
Well, it's a synthetic. It was the first synthetic drug that was registered with our FDA, which is our Federal Drug Administration here in the US, back in 1897. So it started off as do you wear blue jeans? It started off as the coloring of blue jeans, actually, as a textile back in the mid 1800s. And somehow in South Africa, they realized that at high doses, it treated malaria. And it was the first drug available for malaria. And it kind of spiraled from there for the first 50 years of its existence. It was the only antimicrobial available before antibiotics and antimicrobials in general came out in the 1950s. So it was used for urinary tract infections. It was used for malaria. It was used during World War II. Pilots that were in the Pacific Theater were taking it to prevent fungal infections and trench foot. They even had songs that they would sing about blue urine, because when you take Methylene Blue, whether you take it orally, IV, as a troche, as we have it, which are these things that dissolve in your mouth, then it's going to concentrate in your urine on the way out. And as a result of that, you do have blue urine to some extent. Sometimes it's mildly blue, sometimes it's floridly blue, sometimes it's bluish green if you've been having your B vitamins in the morning. It just depends on your...
It's neon green then.
Neon green, exactly. So it depends on your ecosystem in the urine, but in general, it's going to make it slightly blue or whatever colored in combination. But so it was around a long time as a antimicrobial. And then in the 1950s, it kind of came out of favor as an antimicrobial. And then it was actually the drugs that were derived for psychosis were derived from methylene blue, because methylene blue also is something called a monoamine oxidase inhibitor, which just means that it's increasing some neurotransmitters in the brain. It increases norepinephrine, dopamine, and serotonin. And so it's a mild mood booster on its own. It's actually been studied for bipolar, for depression, some pretty interesting studies. But it's a very old drug, so you can't get any billion-dollar blockbuster at the end of the rainbow, is what it comes down to. But in the early 1950s, it was used as the compound that these other drugs were derived from. Something like chlorpromazine, which is a very old antipsychotic, was derived from methylene blue. And so it was sort of in that track, it was used for derivations of antidepressants and antipsychotics, and then also used as a stain in the lab. And many of people like me, we first saw methylene blue as a stain, and it stains cells. And where does it stain cells? It actually stains the mitochondria. And what does that mean? It means that it's concentrating in the mitochondria. Okay, and so where do we have the most mitochondria? Pretty easy. For the most part, people would think the brain, right? The brain has tons of mitochondria, the heart as well, but also your muscle tissue and your liver. Those are your places that you have the most mitochondria. And so where's methylene blue going to go? It's going to go where you have the most mitochondria that are asking for more energy production.
Wow. So there's actually an argument then that those are the areas it's going to target to be more healthy. So you're looking at like your liver conditions, your heart conditions, brain conditions, and of course, muscle fatigue. Because I notice it's ridiculous that we take it, especially if you have a long day at work, but I work physically. So I'm the chiropractor. So what I notice is on days I don't take it, I feel like someone has literally taken some of my batteries out of my muscles. And I thought I was going mad. I was like, the next day I play tennis and I was like, I'm taking methylene blue before I play.
Yep. We definitely see the difference. We definitely see the difference physically.
Well, 100%. I mean, and this is something we see across the board, is that it increases aerobic capacity. It increases the amount of time that you have that you can still make energy from oxygen, because you're getting the whole process of energy metabolism revved up, and you're giving it support while you're doing it. And it's not only that, in people that have mitochondrial dysfunction. So these are people that often have chronic complex medical illness. They have inflammation, they have chronic infection, they have chronic something that's been going on for a long time, and their mitochondria have taken a hit. Oftentimes the mitochondria have these complexes. They're called complex 1 through 4, just the numerals themselves. And oftentimes it's the first couple complexes that get injured or that aren't working as well during mitochondrial dysfunction. And the cool thing about methylene blue is it actually bypasses those first couple complexes. And so if you're having mitochondrial dysfunction, you're able to bypass those first two complexes and continue to make energy, even if they're not working. And those are the complexes that are really important for making energy from the food that you eat. Those first two complexes, they take something like NAD, which a lot of people have heard about now, and FAD, which is the other electron donor to the mitochondrial respiratory chain. But anyway, the high level there is that if you have dysfunction in your mitochondria, the methylene blue itself can bypass a couple of the places that are most commonly not working and help you continue to make energy, because it actually donates directly to complex 4, which is called cytochrome oxidase. And so you have this ability for endurance, especially when you start running out of energy from the food that you're making. You still have methylene blue that's donating electrons or helping make more energy, even if you don't have that, that capacity from what's called glycolysis, or the breakdown of your sugars in your body to make more energy, which is like your wall, right? When people talk about hitting their wall or just feeling like that fatigue set in. And this can be very, very very quick in people that have chronic issues. And I've seen a lot of this in long COVID patients. A friend of mine, actually, I was just talking to a couple of days ago, is that he has exercise-induced fatigue. And this is super common. And what he's starting to do is just taking some methylene blue a few times a day, low dose, either in the mouth or just swallowing it, because methylene blue is actually okay to swallow. We make these things called buccal troches at my company that dissolve in your mouth.
We use.
Yes. Do you guys use it buccally or do you swallow it?
I usually buccally.
Yes, well, actually, I stick it on my tongue on the roof of my mouth because luckily I have blue teeth. I've not yet worked out how to do that to not have blue teeth.
Yeah, the blue teeth will eventually go away, but they do make your teeth blue for a short period of time.
Yeah.
So people that have more cognitive issues, I definitely recommend dissolving it in the mouth. You said you put it under your tongue?
No, we put it on our tongue and stick it to my roof of my mouth is what I do.
How long does it take to dissolve when you do that?
Maybe 3 to 4 minutes. You just have to be really careful not to lick your lips.
Yeah.
That's really quick, but that's interesting because I haven't heard of that particular way of doing it, because typically we do it between your upper cheek and gum as far back as possible. But yes,
it takes too long, and I notice my teeth go blue. But if I do it that way, no one can see my tongue is blue at the back. So for me, that worked better. I don't know.
I don't mind it. People just think I like slush puppies. It's the end of the world.
There you go. Yeah, or you've kissed a Smurf. One of the yeah, or something else with the Smurf we want to talk about. But anyway, that's interesting. I'll have to play with that, because the idea with the buccal troche is that we like the slow dissolution between 15 and 30 minutes, because that helps it dissolve, because the buccal mucosa here in your cheek is actually very vascular. And if it gets dissolved slowly, most of it's going to get dissolved in your cheek. Up on the upper roof of your mouth, or if you swallow it, most of it's going to be swallowed, I think. And that's not necessarily a bad thing, except that it's just a little bit slower onset of action as opposed to dissolving it buccally, but you can play around with it and see. I think that
we do leave a delay, don't we? I think we've just gotten used to the delay. So we always take it about 40 minutes to an hour before we want it to kick in.
Yeah.
We've kind of worked out that's what it takes.
Yeah, that's about right. That's about right if you're swallowing it on an empty stomach. If you're or you're putting it in the location you're mentioning, if you put it in the buccal area, it's about 15 to 30 minutes when you typically start feeling it. So it's a little bit faster. And so for people that have more cognitive issues, we talk about using it buccally, at least to try it. I know it makes your mouth blue. So if it's an issue, or if it's not as much cognitively focused symptoms, then swallowing it works on an empty stomach typically. So I have people that are super sensitive that will take, so our troches are 16 milligrams. Some people will take 4 milligrams and have to take it with food, because their body just is, even with the support that it's giving, is still have the issue that they need slow release with food over time. But for the most part, it's either on an empty stomach or buccally is the best ways to do it.
It creates a slight...
I'm going to play with the other one.
It creates a slight sort of funny sensation, I think, and I don't know. Some of my patients have panicked. I think that's an allergy, but I don't think it is. It does. I don't know if it does on everybody.
Tingles, or
it tingles a bit.
Irritates maybe slightly.
That's normal, isn't it? I think.
Yeah. So it's got some peppermint in the formula, and it's the peppermint itself that can cause some of that tingling that you're describing. And some people do have a significant sensitivity to that, and they can get some numbness from it. And if they do, then I don't recommend they use it in their mouth. I do recommend they swallow it if that happens.
What's the way around it? That'd be interesting to know.
If it's mild, though, I wouldn't worry about it. But if it's more significant, so we've had people with some numbness for like a day after taking it or something, and then if that happens, I usually say, let's just have you swallow it on an empty stomach instead of having the numbness. So
my health coach made a numb in her throat. That's why I'm asking, really, and she's got peanut allergy, so she's scared of that numbness. So I think it's I wasn't sure if she was allergic or whether that was a problem.
No, it's not an allergy. I mean, I think it's been described, but it's very unusual or very uncommon.
I've not seen it anywhere else in any of my other patients.
To be allergic and to methylene blue, it's really the peppermint in the formula that we've seen. So yeah, I mean, if that happens, we just tell people, just swallow instead of just blue. It's just swallow. So just swallow.
How about safety of it? I think it seems pretty safe from what I can see in the research.
Yeah, totally. So interestingly, so we're using it now as this mitochondrial optimizer, this mood booster, and still uses a stain, et cetera, being used in studies for bipolar and depression and things like that. And it's been around a long time, as I said. So the safety is pretty well worked out. It's still on the World Health Organization's list of essential medications as well, because it does treat malaria, and it does also treat carbon monoxide poisoning and cyanide poisoning. If you get cyanide poisoning, I hope that never happens to anybody. Please go to the hospital. Or carbon monoxide poisoning, best to get into a hyperbaric chamber, but if they don't have one, methylene blue is a great antidote, because it helps with how red blood cells are carrying oxygen to the tissue in both cases. And then also in cyanide poisoning, interestingly enough, it's because cyanide destroys the first couple complexes of the mitochondria. And so you have the ability to continue to make energy because the methylene is bypassing those things, as I said before. But it's pretty cool. But again, I don't recommend trying it at home or anything like that. No, please don't. But safety wise, so we know, like, from babies to 90-year-olds, it can be very safe. Okay. Pregnant women shouldn't take methylene blue, and breastfeeding women shouldn't take methylene blue. There is some potential risk of teratogenicity, but it's unclear exactly what that risk is. But in general, if you're pregnant or breastfeeding, don't take methylene blue. Although I do know people that do this, I don't recommend it, but they do it, and they have their doctors doing that with them, and that's okay. And that falls into this other category of SSRIs, and patients that are taking antidepressant medications that have SSRI capacity. So this could be like your older Prozac and Zolofts and Sertralines and Celexa of the world, or it could be the newer ones like Effexor and Pristique, and other ones that are these, like, they're called SNRIs. They're a combination serotonergic along with another neurotransmitter that they increase. So the risk is because methylene blue also increases serotonin in the synapse. So the worry is that the combination can lead to something called serotonin syndrome, and that's very dangerous. However, that only seems to be described at extremely high doses of methylene blue and high doses of antidepressants. So in general, as a company, we say you shouldn't take methylene blue if you're on one of those medications.
If you're on a very low dose or coming down, that might be okay.
Yes, exactly. However, with a practitioner like yourself, Jess, and you're working closely with your patients, my feel is, and I do this in my own practice, I'm using them in combination, but I'm doing it with very close supervision just to make sure that they don't have any symptoms or side effects and things. And typically it's not an issue. I spoke at a conference, was maybe about 4 months ago, and it was a psychiatrist friend of mine, and she came up to me afterwards. She's like, I'm using methylene blue on everybody. It's great. I'm like, even your patients with antidepressants? She's like, especially. I'm like, okay. And so, but she was looking at it very closely, in very low dose, and felt very comfortable with the whole thing. So again, as you were describing, we're using a very low dose in my company. So 16 milligrams is very low dose. Once you start getting to be above about 1 milligram per kilogram, which is about 70 milligrams for most people, 50 to 70 milligrams, that's when you have to start thinking about something called G6PD deficiency, which is a genetic blood problem where you have a higher risk of having your red blood cells break if there's too much oxidative stress. And it's very rare. It's something that you also check in patients that are getting high dose IV vitamin C, for example. You want to check the G6PD level before you give high dose IV vitamin C. So that's the only other thing you have to think about. And then, of course, the other thing you have to think about, I guess, from a safety perspective, is just your quality of methylene blue, because there are some really great headlines in like 2021 it was regarding our company. Somebody got on wind on Twitter that we were using methylene blue for optimization, mitochondrial for function, and there's some great clickbait headlines of biohackers using fish tank cleaner to reverse their age. And it's a great headline. It's catchy. It's gonna make eyeballs pop because methylene blue is still used in fish tank cleaner. That is absolutely true. It's used as an antifungal, as an antiseptic, and so it cleans fish tanks, right? And it helps the fish too. It actually can treat the fish with fungal infection.
It makes it look nicer too.
Yes, but don't drink fish tank cleaner that's supposed to be from fish, right? And so you should be getting methylene blue. You'd be surprised, right? People. But again, Darwin Awards. Have you heard of Darwin Awards? Right.
Yes.
So anyway, but yes, the Darwin Awards. So what we just say is you want to make sure you're getting your methylene blue from really, really good sources. So pharmaceutical grade, tested for heavy metals, because a lot of the industrial grade, chemical grade, and the fish grade, or whatever it's called, is contaminated with heavy metals. So you don't want to have any of that if you can avoid it, is what it comes down to.
How about the dosing? I mean, from like a daily point of view, but also a longevity term. So, I mean, I know yours come in a very helpful little 4-pack, but then also each one is separated into nice quarters.
Yes.
And I mean, I know I've only ever tested it. I took one of your tablets once, but really I take a half or a quarter. I take a probe. What sounds like a very low dose.
It works well, though.
Yeah, that's the thing. So the testing that we did beforehand was based on research that low dose, very low dose, like we are doing, was helping cognitive function, especially looking at research in Alzheimer's disease and Parkinson's, and a couple other studies that are being done in sort of mood-related disorders. And so we chose a dose that we felt was going to be more of a mitochondrial optimizer, helping with energy production, but also antioxidant capacity, and not giving a higher dose, which can be used for more acute things. So acute infection, acute inflammation, acute trauma, acute ischemia, those kinds of things. That 1 milligram per kilogram is a pretty great dose for those kinds of things. And so we are working at our company, and this is something that you'll get involved with too, Jess, soon, is that we were working on a newer line just for professionals with a higher strength methylene blue available. And this will be at 50 milligrams, 50. We have a 16 milligram tablet now, or troche. But as you said, Xandra, dosing is very interesting. We have people taking just 4 milligrams a day or regularly and seeing a significant benefit. And some people are taking 8, some people take 16. I have some people take 4 milligrams a couple times a day if they have brain fog or cognitive issues, or they're having fatigue and kinds of things and trying to recover from a particular infection. But the dosing we chose, the 16 milligram dose, was based on the data I was describing. But I mean, there certainly are reasons to use higher doses, and I think that's why we've been requested by many practitioners actually to come out with a higher strength one that they can use when they need it with their patients.
Mm-hmm.
So we're going to do that. That'll be out in a couple months, hopefully, if all goes well. Yeah, and that'll be just for practitioners, and it won't be for the regular consumer base, because once you start getting at higher doses, there's other risks. And I forgot a couple other risks.
Well, they start going through all these tablets. That's the only thing I found with my ones who need a little bit higher. It'd be helpful.
Yeah, exactly. So then you have a higher dose that you can play with, especially as a practitioner, when you can be following them, right? You can be working on it with them, and you're just surveilling them is what it comes down to. But because the problem with some higher doses is that if you take higher doses for long periods of time, it can build up in the system and cause stress on the system, oxidative stress. And then there's some risk for your gut microbiota as well, the biofilms in your gut. We know that at about 25 milligrams twice a day, about 50 milligrams total, it does have significant effect on Bartonella, which is a co-infection with the Lyme disease organism here in the US. And so we know that it also affects the biofilms of regular bacteria as well. So if you're at higher doses for long periods of time, it may affect your gut biofilms. It may affect, it also can potentially build up in the body. There's also a risk of gastric ulceration as well. So that's why we don't like people doing high dose for long periods of time. So those are the reasons we went low dose. And we wanted to have something, I guess the final thing I would say is there's something you can take sort of like a health optimizer, right? So you could take it as a regular daily, or regular, if not daily, multiple times a week, and still not have to worry about any side effects or it building up in the system.
And how long do you think it lasts? Our observation is it's about 5 hours or so, but it might, and sometimes I feel good for the whole day. So it's a funny thing. I'm not sure if that's a dosage. Yeah.
Yep.
It's about 4 to 6 hours half-life. Yeah. So that makes sense.
Yeah.
And so if you're taking it multiple times in a day, so sometimes what we'll do with people that have long days, like in a hospital or in a clinic and things like that, you take part of it in the morning, part of it in the afternoon. And we have people that take our other product, the blue carnitine, which is the one that has nicotine and caffeine in it, as kind of like their Adderall equivalent. And so and it really works well. And then we've been able to titrate a lot of people off that drug in clinic settings using the blue carnitine. But sometimes actually it's just the Just Blue on its own can do it for some people, because they just need to have the energy. It's not so much the focus that they need. It's just like having the ability to, like, as you guys said, just kind of bring it through the rest of the day. Most of us have some level of ADHD these days because of our phones and things. And so most of us don't need the dopaminergic hit as like blue carnitine to really feel a difference, but some do. And that's okay too.
And then one thing I do notice is also it's got some research that shows it helps you sleep as well, which is weird because it gives you more energy. But I think my sleep is definitely better also when I take it.
What time of day is it you're taking it? Like you're finding your sleep is better?
We always take it in the morning.
I sometimes take it lunchtime, actually. It depends. I sometimes take mine at lunchtime because it depends what I'm doing in the morning or afternoon. But I also notice my sleep is better that night.
Yes. So that's absolutely what we've been seeing across the board. And we have people that take it before bed too. Now, if you take it before bed, I recommend swallowing it for sure, because it's going to take a little bit longer action so you can get to bed. But we know that sleep is not just a passive process. It's a process where we're actively tuning up our brain and detoxifying and making energy to do all these kinds of things, especially in REM sleep, but even in deep sleep too. And so again, I had a friend a couple of days ago, this kind of top of my mind, that has having a hard time sleeping. He's a post-COVID kind of syndrome thing. And so I had him swallow the Just Blue before bed, and his deep sleep went up by double. And
yeah, I noticed that on this. I've got an Aura that tracks it, and definitely, my deep sleep was bigger.
I track it as well. So I track it with various things. So sometimes we'll use the Just Blue before bed, combining it with other things, maybe depending on the situation, but definitely can see in people that have a hard time sleeping from inflammation, especially, and from stress, usually oxidative stress and inflammation that kind of go together. Those cases, we can definitely see a benefit in patients. So I would just have them swallow it about an hour, half hour before they go to bed, kind of thing. But absolutely, yeah. I mean, we have people take it all times of the day. That's the nice thing about this particular product is it doesn't really matter what time you take it. You can go to bed at night.
I'm assuming its longevity is fine. So, I mean, I am taking it quite a few days in a row. But every now and then I wonder, should I have a day off? Should I not have a day off? I don't know. My brain doesn't want me to. And then I'm looking at, should I have a day off? I'm doing
I know
nothing.
the feeling 100%. And so we really don't know if there's any downside at this point to taking it like daily, or should we take breaks and things. I often just think most likely it's probably good to take breaks and cycle like anything else for the most part, except for your regular supplements that you actually need. Like for example, like in my practice, I test people's B vitamin levels and they're low. It's not like you should stop your B vitamins for 2 weeks because you need them. But something like Methylene Blue or something like adaptogens or things that you probably should take on a regular basis, but maybe not all the time, are good to kind of cycle off. I think not for long periods of time, but like a week or two at a time, and kind of come off and then come back on. It's like caffeine, right? People should take breaks from caffeine. It's a really great thing to do. It's hard for people to do, but caffeine cycling is really good. And for the most part, I think that cycling off of Methylene Blue for periods of time is likely a good idea as well. On the other end of it is also cycling up on your Methylene Blue when you're going to be under more stress, and kind of knowing ahead of time. So like if you're going to be traveling, for example, it's a great time to increase your Methylene Blue. We have a full jet lag protocol that we've published on our website and Instagram and things like that we can share if you guys haven't seen it. And it's fantastic. You just have to be regimented. We worked on this for a while, and it's a lot of Methylene Blue actually, but it's the reason we do that is because you need a lot more support when you're traveling on an airplane at low oxygen, getting more radiation, changing time zones, messing with your microbiota, all those kinds of things. So
that'd be interesting.
Do you have any experience of, so if you had an operation recovery, do you have any experience of that? One of my patients asked me this because they'd taken it before, that they're having surgery and they wonder if they could take it in that period after an operation, it would help them.
Yeah. So, I mean, the main things that you need after an operation are things that are going to help you be more anabolic, right? So you want to make sure you're getting good amino acids like glutamine, making sure, peptides can be helpful here too. But I think that we haven't used it in any formal way here. So I don't have anything to say like absolutely yes or absolutely no, but I think it could be beneficial because of course there's going to be inflammation, there's going to be stress on the system. So it's also going to make you feel a little bit better when you can't move as much after surgery, because it's going to give you a bit of a mood boost. So that's always helpful.
Yeah, so that's great. How about autism? I've got a patient. I wonder, have you used it much in patients with autism?
So it's funny. I did a podcast with a lady named Sarah Kleinman. I can't remember her handle on Instagram. It's something long and not what she does anymore, whatever it was. Maybe it's Sarah Kleiner Wellness now. But Sarah's great. She has an autistic daughter that's 13 or 14, and she loves Methylene Blue. Her daughter can't speak, but she can type, and she types these beautiful stories, and she won't do it without Methylene Blue because it helps her brain just function so much faster and so much better. And so, we don't have a lot of data here. That's like my only data point really, but we do know what's happening with an autistic brain. Oftentimes it's it's regulation of blood flow to the brain, energy production, inflammation. So I do think there's probably a role there. It's just something that we don't obviously talk about as a company. It's more something that as a clinician, I think it's safe to use in kids. I think it's just a matter of just finding the dose and working with the parents and feeling comfortable there. But I certainly have some interest in a couple different things. I think autism is one of them with using Methylene Blue. Another one that we're looking to test now is in Hashimoto's thyroiditis in patients with thyroid issues, because we have been getting reports that people that take Methylene Blue don't need as much thyroid medication. And I think
it's easy to monitor once we do it.
Absolutely right. Very easy to monitor. And you can also measure antibodies, right? You can measure like the thyroid peroxidase antibodies in Hashimoto's. You can measure your TSH obviously as well, and their T4, T3, reverse T3, those kinds of things. And so you can measure all of those. And so we're interested in working with a practitioner that's in Tennessee. We're working with a couple of her patients to see what happens with a trial of Methylene Blue 5 days a week at low dose, probably a quarter or maybe a half a troche at most, and swallowing it and just kind of seeing what happens to the Hashimoto's antibodies and to the thyroid, the TSH levels and things like that. So I have a lot of interest in conditions where there's a lot of chronic inflammation. So fibromyalgia, chronic fatigue syndrome, those are another ones. Obviously the long COVID side, because we know from experience that this works. And I've had clinicians tell me, like, I give it to my 65 to 75-year-old females and they can go clean the house and go get their hair done and they love it. They love their blue pills. So
I've just given it to someone in their 80s who has brain fog, so we're going to see. She thinks, because their memory is just feeling a little bit unstable. So I think, yeah.
How about like a child going through exam periods? So that's where I see the most, my patients, especially their high stress periods, 13 to 16-year-olds who unfortunately are also struggling massively with their hormones. And then we go and stuff, SATs and GCSEs are equivalent there.
Yeah.
And, I'm assuming a dose that's around, a quarter of one of yours would be, an okay dose to take during an exam period.
Well, certainly we are getting more popular in college campuses here in the US because most everybody, I mean, this is actually surprisingly, maybe I was just I'm too old now, but Adderall wasn't a thing when I was in college, I don't think. But it's a huge thing now. I mean, people are just passing it around like candy for exams, and we know how bad that is for people. And it causes anorexia. You can't eat, you can't sleep. You get the jitters, you get nightmares. It's terrible, but some people love it, but for the most part, it's not a very happy drug for most people. And so this is great. Bluecanatine's is a 4 to 6 hour. So our canatine drug, our canatine formula, it's not a drug, it's a formula. Our canatine's formula has really been popular in that age group because it's an alternative for people to use. It doesn't last as long, but 4 to 6 hours is probably as much as you need anyway when you're trying to do high intense kind of studying and things as well. So the Just Blue by itself, we haven't had as much experience with it being a study aid per se, other than it's going to increase your endurance, right? So you can probably study for longer.
Very focused though. It makes me I would say that I use it when I've got an afternoon, I've got loads of notes to write and loads of stuff. And I'm a bit of I'll flit sometimes and I'll get distracted by my email. If I take, it's the most impressive workload I can get through if I take Just Blue. So I don't know, maybe it's just the person, but I find that one I think it's fantastic. I mean,
it really does.
Try the other one.
No, yeah, you don't have to. You don't even try it. There's no need, right? But for some people, they just need the additional hit of the stimulant effect with a little bit of caffeine, just a teeny bit of nicotine. It's 1 milligram of full troche, but it's if you take it, usually most people take a quarter or a half, so it's a very little bit amount of nicotine. People get scared about it, but nicotine's a very safe drug in very low doses that's been around for a very long time. And if you don't vape it or smoke it, and you keep it at very low dose, like a cigarette has between 6 and 28 milligrams of nicotine. Vaping products have about 25 to 50 milligrams of nicotine per hit, kind of crazy. And our troches have 1 milligram, non-tobacco derived. So this is something that you think about in your patients that need the focus. They're kind of more on the Adderall side of life. They're more ADHD kind of people. But you will find, Jess, there are hyper responders like you that won't need the stimulant at all and just say, I'm good on methylene blue. So, for me, when I take methylene blue, I feel elevated. I feel like my mood is up. I feel like my energy is up. I feel like I can go, but I don't get like, snap my fingers like I'm ready. But if I take bluecanatine, it's like, what else can I do?
I might be dangerous on that.
It might also be something to do with caffeine though, because you're a coffee drinker, so you have caffeine.
I have caffeine quite regularly, I would say.
Whereas I don't.
Times a day.
I'm completely caffeine free. I can't in any way take caffeine, but for me, this is a good alternative. Works absolutely, and I think I annoy everybody on my to-do list when I take it.
That's awesome.
I finish every single item.
Yeah, me too. That's what I think. I think it's like a to-do list thing. I think as women, you just have this huge to-do list all the time. This is how I get through it. So.
It is been through it, but I love the physical side. I really do, because especially if going to a personal trainer, going to a gym beforehand, you take this beforehand, and you just drive them mad. I know I drive my tennis coach mad because I take it before, and it's like, why are you winning today?
Professional wise, is it okay to take for athletes? That's just a question. One of them asked me. There's someone wanted to take it, and I went, I don't know the answer to that.
Yeah, it is. It is. It's WADA approved, so you can take it. Our particular formula is not NSF certified, so some sports teams will refuse to take anything that's not certified for sport, but that's just a crock of malarkey, really, that whole process. But yes, we have professional baseball players using it. We have professional tennis players. We have hockey players, football players, and also it's a protecting of their brain kind of thing too. So I have a couple of my own clients that I use it with, along with hyperbaric therapy and everything else that I do. That methylene blue is something that I take. Like, look, dude, you need to take this before you get on the field, because if you hit your head, you're going to be better off than if you didn't have it in your brain. So these are things that we can use, and that I have higher dose protocols that we use as well with people that have more of acute issues. And sometimes I will go as much as 1 milligram per kilogram in some people if it's required. Very rarely, but in general, methylene blue is fantastic for the athletes. I'm trying to work with a biking team here in the US to start trialing it as well. But the problem with it's just hard to get to
amazing though, surely. I mean,
yeah,
they see a massive difference in cyclists.
Yeah.
Tour de France will have blue tongues. Great.
I know, everybody was the blue tongues, right? Passing that'd be like, I could retire if that happened.
Yeah. My own question though would be kind of post-infective. So what I noticed was when Jessica started giving it to me, because we're bombarded by patients. I mean, I can see 40, 50 a day. My immune system definitely can struggle occasionally. What I've noticed though is that by taking this regularly, I just don't get sick ever. I seem to get infections. But also, if I feel like I'm coming down with something, it seems to really improve that. So I'm assuming you must have quite a good
that's the anti-infective
side. Yeah, infective side.
Oh, for sure. And people say exactly what you just said. If they feel like they're getting cold, like getting a cold or getting sick, they just kind of start popping a little bit of extra methylene blue, and they feel better, often very fast. It's very, very common. Yes, and your immune system is stronger than most when you're seeing that many people a day. My father is also a chiropractor as well, and so I mean, he was running through COVID the whole time, and it didn't.
So was I. I would probably I was the least bothered by COVID. I think
I was the least sick through COVID. I find it interesting.
I wasn't really bothered by the idea of it.
Your immune system is so primed for anything. Like if you're an ER doctor or you're a chiropractor, or even a primary care, like when you're seeing so many people all the time, it's like your body's like, what you got? I got this. And so my dad's also very physical. Like chiropractors are very physical, and he does take methylene blue regularly because of the physical nature of the practice as well. But he's been using it, and I've been using it in my clinics and other practitioners as this sort of preventative, prophylactic as well. So if you know you're going to have a high risk of getting sick, or you feel like that's coming on, it should be part of your stack of things that you're looking with, like your vitamin C, your other kinds of things too. But adding methylene blue can be really a game changer for a lot of people, for sure.
It's that longevity side as well. It's got that other side in which it showed a study, didn't they, where the cells live much longer with methylene blue.
Yeah, so it was looking at senescent cells and mitochondrial biogenesis. So senescent cells are the cells that build up as we get older. They don't work anymore. They're called zombie cells. They have, the more of those we have, the higher risk we have for degeneration, cancer, inflammation, et cetera. And so it seems that somehow methylene blue decreases the population of those. Not exactly sure how, but it seems to do that. And the other thing it does is it helps with creating new, healthier mitochondria. And so that could be the way that senescent cells go away. That it's hard to know, but it's hard to know if those two mechanisms are connected or not, is what I mean. But regardless, it's increasing the number of mitochondria you have as well that are optimal. The new mitochondria are better. Old mitochondria, they need to be recycled and die, so that they have a life cycle like anything else. So there do seem to be longevity benefits. Of course, my dog is gonna come out.
We've got two in sleep in the cage nearby. Don't worry.
Did you drive them?
Every now and then, but you can't quite hear them.
Yeah, my dog's funny. But anyway, that's what I would say on the longevity side. We don't have a lot of longevity data with methylene blue because it hasn't really been used in that capacity. But my feel is because of what it's doing on the cellular level, we're going to have significant benefit there. So.
It's what we've seen. I mean, it really is one of the most fascinating things we've started to take. And, more importantly, we can see its longevity in how we use it and how we take it. But also you can't help but look ahead and go, gosh, as we get older, it becomes even more important because you can start seeing, this could massively help us with our career longevity as well.
Yeah, career longevity is a big thing. I think a lot of us in the service community have that feel, is like, how are we going to maintain our level of energy, a level of focus, a level of drive? And part of the drive piece is having things that we love to do. It sounds like you both love what you're doing and enjoying the things that you're doing. Do you both work together in the same practice, or how does how does it work?
Same building. So we just have a floor each, really. The chiropractic's all downstairs. Jessica's patients are a bit more mobile, so they're
very hot at the moment.
Yeah, they are hot. But
everybody's hot. Yeah, everybody has to go downstairs to Xandra's place to get.
She's got the air conditioning.
We have the air conditioning downstairs. See, so
oh, you do.
So you ever want to keep patients and your reception team happy? Make them cold.
Keep them awake too, right? That's the thing that they do.
Literally, they're so happy they don't want to leave work. I'm like, excellent, come to work.
That's lovely. I love that. How long have you been working together, the both of you?
how old was your daughter? 10 and a half years?
Yeah,
Almost
she came
11
home.
years.
She
11
came home when I
years.
was pregnant with my daughter.
That was the
So,
deal. That was the deal. I had to come home and
brought
just
her
go
home from
pregnant. I swear she got pregnant like very soon after.
Chiropractors can do that. Chiropractors are good at the fertility thing, man. I
They
know.
do. Yeah, true. Maybe the adjustments.
Adjust a couple things around, and I don't know, everything seems to work better. Who knows?
Everything works. Everything much better.
Yeah.
Yes, we've worked together for quite a long time now. It just works really because all the patients who Jessica sees who require some sort of chiropractic come downstairs. Mine who often will come and see me, and then that's the first port of call to anything natural because of course we have the NHS. So as soon as they see that one thing alternative works, they start asking questions about what else they can do, and I'm like, if you went upstairs and then you can get the full kind of general practitioner experience, but actually not with 3,000 drugs.
Yeah, so it gives us the structural plus. It's a great combination for us.
Yeah. And Jess, what is your main population? Does it run the gamut, or do you have a specific population you work with?
Pretty much be anything, I think. I treat from newborn babies right up to, I think my oldest patient's in late 90s. So I think I have a huge range of, and then just about anything from advanced cancer to anxiety to eczema to ADHD to autism. Yeah, anything. And my day's great because I can see anything, which I really enjoy. But equally, I like to use all the natural therapies. So for me, it works very well. I think trying to find a different way than the NHS is using at the moment and trying to look at the lifestyle stuff and the root cause medicine instead of just firefighting on the top.
But also we have a similar theme, and that is, we both basically deal, probably 85, 90% with inflammation. Yeah. And that is something that, is certainly not getting lower.
No,
it is only getting,
not in the world of COVID and everything else,
drastically higher. But now people don't heal as well. That's what we noticed post-COVID, is that people's healing ability that was quite good going into COVID, what I'm now seeing is people just don't heal. We have to throw supplements, gut health, nutrition, diet, everything at them, as well as chiropractic to start down the healing pathway.
Are you seeing it both in people with post-COVID and also post-vaccine as well? Or are you just seeing it on?
We've seen these massive spikes. I mean, we now can pretty much link them. Either you've had COVID, or you've had had one of the 5 vaccines going through, and like every time they're getting sicker or something else is post-inflammatory.
And the inflammation markers went up massively in my bloods. Yeah. They were all shot up. And kidney failure. I've had 2 patients going to kidney failure. So I would say that. Yeah. Observationally, in my practice, there's a very definite problem going on.
Yes, I understand. And I'm seeing it in my practice too. I think what we don't realize is that there's a lot of immune system. So what happens, I think, is that there's the immune system is getting revved up so much that it causes this huge sort of immune depression afterwards. And then you have the reactivation of these various types of things that were an issue for a lot of people, like Epstein-Barr virus or mold illness or Lyme or other kinds of things that weren't an issue. And now the immune system just hasn't recovered. And then you get these reactivations and things just go,
and then they're exhausted and then they get chronic fatigue. And then, they call that long COVID, but I'm not sure in some cases. You look at it.
It feels like there's a spiraling inflammation.
Long vaccine COVID, I don't know. But
it's so, and then, I know they've documented cases of a year later, the spike protein still hanging around in some people. So it's a real big deal. I get it. And I've seen that too, but I mean, you guys are on the front lines over there. I know it's got to be hard, but the good news is that we have, ways to help optimize, using your manual therapies along with supplements and diet and checking labs and bloods and things like that, that would be obviously not done in the NHS, right? So, and that's
a great tool in that mix. It really is helpful.
And it's a really great talking point. It's one of the reasons why I don't want to get rid of the blue tongue is because, I kind of have a debate as to how many patients are going to ask about it.
Sure. I got it. Yeah.
I'm scared of you.
How long it took for someone to actually, it took like them seeing me for probably 3 or 4 days with a blue tongue for them to finally go, it's 8:30 in the morning. You clearly have not had a slush puppy at 8:30. I'm like, hey, it's not the question. And we go down.
Our receptionist is doing it now. Our receptionist on the front desk. Everyone, she's like, look at my tongue. And then she starts off with this.
Because we thought, we revved up, our brains feel better. Everything's going great. Why not help the rest of our team as well? And we started seeing that everyone was seeing a nice improvement. And
it's great for business.
It's the best way we can do it.
It's great for business.
I love it. That's amazing. I love the way you're describing it and the way you're doing it with people is like, okay, I'm doing this. So you see what I'm doing. And then you have to ask what I'm doing instead of, because people are really curious, whatever's wrong with your face or your legs or like, they're like, what's wrong with you? Why are you doing this? And so like, and it's very common to do that. One of the things that we say at our company is one of our taglines is blue is the new smart, right? So it's not like why my tongue is blue. It's why yours isn't. Right. And so And
It's what
We
patients
might be
do
in that
though.
club. We might be in that club.
My patients almost always do that. If they see I'm doing something, they immediately go, "Why am I not doing it? Maybe I should be doing that. How do I do that?" And they immediately go for that question because they do want to mirror you, and that's what you want. You know, we
Exactly.
always try and mirror health. We don't ever give advice out we don't do, because what would be the point?
I'm 100% with you. I really do feel like practitioners the way through for most patients, right? For people there are consumers that are buying our product, but you know, if you're anything like most of the practitioners that I know, and it sounds like you are, your patients are going to listen to you about 90% of the time. They're going to try to listen to you 90% of the time. They may not always follow through, but they're going to try to listen to you 90% of the time, right? And so it's a nice way of saying, look, this is what I'm doing. This is what's working for me. Mm-hmm. And the beautiful thing about Methylene Blue, as you were alluding to, Xandra, is that it's something that can be added almost all the time to help you. It's not something that you have to wait to add. Sometimes if you don't want to do something right away because it's going to be too stressful on somebody, whether it be a chiropractic manipulation, they're not ready for that. Or if it's certain supplements, you're like, you're not going to do that right now. But with Methylene Blue, you can actually add it almost any time. And that's the beautiful thing about it. You sometimes have to start at a very, very low dose, but you can titrate them up over time. And
you don't really wait for the effect. They get the effects quite quickly. It's quite a fast win, which is quite good for a lot of people.
And patients can be slightly on the lazy side. So if I can give them something they can just take now, they will often go, "Oh, this is easy. I like easy." Normally my homework can be difficult, you know, make bone broth. You know, it's not easy. So, you know, however, you know, take this, you just take a quarter. They're like, "Oh, I can do that."
Yeah, it's good.
Just a little bit, just this much. That's all you need to take.
Yeah. They'll have a blue tongue.
They're like, "Oh, this is simple. I get a packet, I just take one. Okay, this is much easier. I'll do that." So that's why we like it. But yeah, we always try and make sure that, you know, we've taken it for quite a long time first. So then we can go, actually, we've taken it for ages. We know all these different systems that happen. And we can go through it. And, you know, I have quite a few athletes and they love the idea of it. So that's the best one, really.
Yeah, you can give them your experience about what you said about doing your tennis and your other sports activities. I have a lady that I work personally with that will not do her treadmill until she takes her Methylene Blue, because she can keep her heart rate elevated for about 50% longer when she takes her Methylene Blue. And it's like, well, obviously that's when you're going to take it, right? So
definitely take it for your personal training tomorrow.
Yeah,
definitely taking it to see if I can.
Try it. Yeah, try it about 30 minutes to an hour ahead of time, and you'll see the difference. And the other thing, I don't know if you have red light panels there or red light therapy, but we do see a combination with red light therapy along with Methylene.
Interesting. We do that too. Yeah, I didn't really know they went together.
Yeah, so they actually work on the same complex on the mitochondria. So you give Methylene Blue, then about an hour later-ish is when you put them in front of red light panels, ideally. And then it's going to be a double, you know, you don't get much sunlight except for today, it sounds like, in England. But obviously sunlight has red light in it. You can go outside in the sun. But if you have red light panels, like as I do at my house here in Colorado, I will just go downstairs after I take my Methylene Blue, about 30 minutes after that, and then just do my meditation, and then I feel really energized as a result of that. So another thing you can do for some of your patients, if they have red light panels, or if you guys have them in the office, if they're going up and down, going to chiropractic, taking their Methylene Blue, going upstairs, you know, whatever you guys.
We could definitely add a room in to do that.
Very good. Oh no, my building got bigger.
Sorry.
But
red light beds are nice for
and
that.
you can see blue.
Yeah, that's a good idea.
There's lots of fancy red light beds you can use, and those are nice because you can put people in the bed so they get, you know, top and bottom at the same time. And
that sounds great.
I know.
It's a great activator.
Well, I have to say, this was absolutely completely fascinating. I love the subject. I've been looking forward to it for weeks now, which is great. Thank you so much for joining us, Dr. Scott. That was brilliant.
We might bring you back to talk about hyperbaric oxygen at some point.
Oh yeah, we love it. Yeah, thanks so much for having me. This is great. I really appreciate you too. Thanks for being such great examples of not only practitioners, but also people who use the product and see the benefit, because I think that's super cool. And obviously we want to be walking the walk and talking the talk. And that's what we all try to do here at Troscriptions too. So
yeah. Perfect. Brilliant.
Thank you.
Thank you very much.